Is general anesthesia always needed for a bladder biopsy? Imagine sitting comfortably in a doctor's office, wondering if you'll need to be put to sleep for a bladder biopsy. The good news is that general anesthesia is not always necessary. The decision depends on several factors, including the size of the tissue sample needed, your comfort level, and the doctor's clinical judgment. A bladder biopsy is usually performed during a procedure called cystoscopy. During cystoscopy, a thin tube called a cystoscope is inserted through the urethra into your bladder. This allows the doctor to look inside your bladder and take small tissue samples if needed. The procedure itself can be done with different types of anesthesia. Local anesthesia is often used for smaller or less complex biopsies. It involves numbing the urethra and bladder area so you won't feel pain. You might still feel some pressure or mild discomfort, but you will be awake and alert. This approach is common for straightforward biopsies and often allows you to go home the same day. General anesthesia, on the other hand, puts you into a temporary sleep. It prevents any sensation or awareness during the procedure. Doctors may choose general anesthesia if a larger area of tissue needs to be biopsied, or if the patient feels anxious or unable to tolerate the procedure while awake. Sometimes, if more extensive intervention like removing abnormal tissue is planned, general anesthesia is preferred. Sedation, which is lighter than full general anesthesia, can also be used to help relax you during the procedure. After the biopsy, if you had general anesthesia, you will need some monitoring until the effects wear off. You won't be able to drive yourself home. Those who have local anesthesia usually recover faster and can leave the medical facility sooner. Common side effects after a bladder biopsy include blood in the urine, a burning sensation during urination, or mild bladder discomfort. These symptoms typically resolve within a day or two. In summary, whether you need general anesthesia for a bladder biopsy depends on the specific circumstances of your case. It is not always required, and your healthcare team will choose the safest and most comfortable option for you. Always discuss your concerns and options with your doctor, as they can tailor the approach to your health needs and comfort. Remember, personalized medical advice is essential for making the best decision about your care.